Still few students are joining. So I welcome all of you on this occasion of National Eye Donation Awareness Fortnight, which is celebrated from 25th August to 8th September every year in whole of India. The purpose of this program is basically to make all of you aware about various aspects of eye donation. So why we need these types of lecture? Because still in our country there is a lack of cornea donation. The number we need is much more than whatever we are getting. So that's why these types of programs they are required so that we can meet whatever demand we have. So that I'll be covering, and then I'll be covering few aspects of technical part of eye donation, how it can be done, and how you can help this cause of eye donation. And then practically, what do we do with the eyes? How do we use them? So during this fortnight, we are doing so many programs, like you must have heard through the media. We organized one eye donation awareness talk on this Saturday. Good afternoon, ma'am. Dr. Ravneet, I can see you.
Namaskar, sir. Namaskar, sir.
So should I start or others will be joining? I can wait for. I was just saying few other things.
Hanji sir, just maybe a minute. वो सारे क्लास में हैं, प्रिंसिपल सर आएंगे जी.
ठीक है. I was just telling that during this fortnight we are doing many activities. So like we did one activity on this last Saturday, where we organized one eye donation awareness walk on Rock Garden, from Rock Garden to Sukna Lake. So there our mayor, Mrs. Sarabjit Kaur, she came there and she flagged off the walk also. So there are many students from Sect Art School and many students from Institute for the Blind and many other school children, along with all faculty members, students from GMCH Sector 32. They also participated. Our director principal was also there. Our medical superintendent was there. So many NGOs like Lions Club, Chandigarh Supreme, and another Lions Club from Parmanu, Lions Club Gold. Then there is one association of the laboratory technicians. So they also participated. Very big successful program. By that we could aware many people on that day. Similarly, we are organizing various poster making competitions in various schools, slogan writing competitions, then various video making competitions. Like I think you also must have got this circular about video making, very small 1 or 2 minutes video by the college students. So even all these students, they also can participate. The last is 31st August. So you can.
If I may interrupt, sir, we have a principal sir with us, sir. So we can formally begin. Tanuja, are you there? Tanuja?
Yes, ma'am, I'm there.
So Tanuja, if you can come on camera. So good afternoon, everyone. I heartily welcome Dr. Arya, Professor Dr. Arya, for the session on motivating our youth towards eye donation. This is dedicated fortnight going on for the eye donation awareness. इस वेबिनार के शुरू में मैं अपने प्रिंसिपल सर डॉक्टर A.K. श्रीवास्तव जी को रिक्वेस्ट करती हूँ कि सर फॉर्मली सर को वेलकम करें और बच्चों को इनवाइट करें.
आदरणीय डॉक्टर आर्य जी, आपको मेरी तरफ से, मेरी फैकल्टी की तरफ से बहुत बहुत प्रणाम और आपका हार्दिक अभिनंदन. आपके समस्त साथियों का हार्दिक अभिनंदन और स्वागत. डॉक्टर, हमारी आपकी मुलाकात हमारे कॉलेज में अक्सर होती रही है. आपने हमारे कॉलेज को ये गौरव दिया है कि हर साल आप कोई न कोई आंख से संबंधित टॉक यानी चर्चा जरूर करते रहे हैं, उनके रख रखाव, उनके उपचार को लेकर के, उनके सुरक्षित को लेकर के आपने अपनी पूरी टीम के साथ हर साल हमारे कॉलेज में जरूर कोई न कोई प्रोग्राम किया है। डॉक्टर साहब, हम आपके छोटे भाई जैसे हैं और आपका सानिध्य, आपका आशीर्वाद हम सबको हमेशा मिलता रहा है, ये हमारी प्रार्थना है आपसे। साथ ही साथ हमारे कॉलेज का जो भी कुछ गौरव है, जो भी कुछ हमारे बच्चे पढ़ करके निकलते हैं, उसमें आपका, आपकी टीम का होता है, क्योंकि हमारा कॉलेज टीचिंग प्रोसेस से जुड़ करके बीएड और बच्चों को पढ़ाता है और कालांतर में वो जाके एक स्तुति अध्यापक बनते हैं, अच्छे शिक्षक बनते हैं, तो उनकी वही जिम्मेवारी हो जाती है जो आज हमारी और आपकी जिम्मेवारी होती है। और जहां भी जाते हैं वो बहुत अच्छी तरह से इस कार्य को निभाते हैं और इसमें आपकी, आपके टीम की बहुत बड़ी भूमिका होती है। इसके लिए हम सब की तरफ से आपका बहुत बहुत साधुवाद, बहुत बहुत धन्यवाद। साथ ही साथ आज के इस प्रोग्राम के ऑर्गेनाइजर डॉक्टर रवनीत चावला जी और बच्चे, जिन्होंने इस प्रोग्राम को बहुत कम समय में आपसे अनुमति लेकर के ये अरेंज किया है। आपके साथी ने आकर के हमसे ये बात की थी, सिंह साहब ने, उनके माध्यम से ये समय आपने दिया हमारे बच्चों के लिए, इसके लिए हम आपके आभारी हैं। डॉक्टर साहब, हमारे बच्चे शिक्षण कार्य हेतु, टीचिंग लर्निंग प्रोसेस के अंतर्गत ट्रेनिंग हेतु वो अन्य स्कूलों में गए हैं। 2 बजे तक उनका प्रोग्राम होता है और 2 बजे के बाद वो अपने स्कूल से खाली होते हैं। ये हमारा सौभाग्य है कि आपने हमारे बच्चों के परिस्थिति को ध्यान में रखते हुए, उनकी सहूलियत को ध्यान में रखते हुए आपने 3 बजे का टाइम दिया। हम लोग बहुत सुखी हैं इस संदर्भ में और आपके आभारी हैं। मैं अपने समस्त टीम की तरफ से आपके पूरे टीम का आपका फिर एक बार अभिनंदन करता हूं। साथ ही साथ आपने जो भी कुछ हमारे कॉलेज को दिया, बैच बाय बैच हमारे बच्चों को दिया है सर, उसको शब्दों में हम बयान नहीं कर सकते। आपकी आइडियोलॉजी, हम खुद जब डिपार्टमेंट में जाते हैं तो सर आप एक प्रोफेसर हैं, हेड ऑफ द डिपार्टमेंट है, साथ ही साथ पूरी दुनिया को आपने जाना है। अपने कर्मों के माध्यम से आपने रोशनी दी है, लोगों को रोशनी देते हैं। जब हम लोग जाते हैं तो हम सर आपके छोटे भाई की तरह बड़ा प्यार और लाड देते हैं, अपने स्टाफ मेंबर्स की तरह अपने दिल में जगह देते हैं। ये हम लोगों के लिए, यहाँ तक कि अगर फोन से भी हम लोगों ने आपसे कोई बात कह दी कि सर ये मेरा भाई जा रहा है या मेरे स्टाफ मेंबर जा रहे हैं, उनको स्पेशल तवज्जो देते हैं। आपके सारे स्टाफ के लोग, आप सब लोग, हम सभी लोग इससे कृतकृत्य हैं सर, और बहुत खुशी होती है। कभी जब हमारा रेगुलर सेशन होगा, जब हमारे बच्चे आएंगे, तो हम आपसे टाइम लेकर के हर साल की तरह, कोविड की वजह से काफी बीच में रुक गया था, अब फिर हर साल की तरह वो तारतम्यता जोड़ते हुए, वो श्रृंखला जोड़ते हुए आपसे फिर परमिशन लेंगे और आपका कोई न कोई प्रोग्राम बाई फेस टू फेस अपने हॉल में करवाएंगे। हम अंत में आपके बहुत बहुत आभारी हैं और आप समस्त टीम का बहुत बहुत स्वागत करते हैं। और डॉक्टर रवनीत चावला जी और साथी बच्चों, आप सबका भी बहुत बहुत स्वागत है और आभार है। आप जो डॉक्टर साहब बोलेंगे उसको सुनिए, सीखिए और जो कुछ भी उससे संबंधित सवाल है, प्रश्न है, वो जरूर पूछिए, जरूर समझिए। धन्यवाद सर।
Thank you, sir. Tanuja, to formally welcome Dr. So, Tanuja is today the moderator from the side of students with me. Tanuja is a brilliant all-rounder with us. She has been with other NSS volunteers, the president and the vice president and the group leader today is so they are doing the teamwork on the part of the students. Tanuja, over to Tanuja, please.
Good afternoon, everyone. I, Tanuja Upreti, takes immense pleasure in inviting.
Somebody to mute, somebody who's unmuted. Please be careful. Somebody needs to mute among the listeners. Okay, Tanuja.
Good afternoon, everyone. I, Tanuja Upreti, takes immense pleasure in inviting our guest speaker of the day, Professor Dr. Sudesh Kumar Arya, Incharge, I-Bank. Sir will be delivering an awareness lecture to encourage us all to contribute for the noble initiative. Before inviting him on the mic, I would like to give a brief introduction about Sir. Dr. Sudesh Kumar Arya, Sir, is working as Professor and Head Cornea, Eye Bank and Refractive Surgery, Department of Ophthalmology, Government Medical College and Hospital, Chandigarh. Sir did MBBS from Pandit B.D. Sharma PGIMS Rohtak in 1988, followed by MD Ophthalmology from Dr. R.T. Center for Ophthalmic Sciences, AIMS, Delhi in 1991. Sir was awarded Fellow of International Association of Contact Lens Educators, Sydney, Australia in 2000. After completing senior residency at AIMS, Sir worked as lecturers at Pandit B.D. Sharma PGIMS Rohtak for 4 years and then joined as senior lecturer ophthalmology at Government Medical College, Chandigarh after selection through UPSC in 1997. He became officiating reader in 1998 and through UPSC in 2000. Sir worked as Professor, Department of Ophthalmology, BP Koirala Institute of Ophthalmology, Taran, Nepal, on deputation from 24th June 2007 to 31st October 2008. Sir has won numerous awards, including the National Talent Search Scholarship from National Council of Education Research and Training, NCRT, in 1981, Appreciation Certificate, Vishwas Eye Foundation, Hisar, Certificate of Academic Excellence, and many more. Sir, we would like to hear more from you. Please come on the mic and enlighten us.
Thank you, Tanuja. Over to you, sir.
Good afternoon, everyone. First of all, I'm really thankful to management of this college, Government College of Education, Sect. I'm especially really grateful to Principal Shri A.K. Srivastava, Dr. A.K. Srivastava, who said so many things which I don't think that was required. It is all because of his affection. I'm really grateful to you, sir. And Ma'am Dr. Avneet Chawla, who is organizing this program. I'm really thankful to you also for arranging this talk for these students. And because all these students, they are going to be future teachers, as you said. So that's why it is very, very important that all of them, they should be aware of this very important social aspect of eye donation. Because once these students, they themselves, they are motivated and they know about this eye donation, definitely wherever they will go and they will teach the students, further they will train their students as well. So in this way, a chain will start and ultimately our whole society can be educated. And a time will come when I think we will not require these types of lectures also. Everyone will be self-motivated and self-dedicated. So that is the aim of all of us. That is possible if we take keen interest in these activities ourselves, then subsequently we can motivate others. So every year Government of India wants this program from 25th August to 8th September. We must do very seriously so that we can motivate as many as people possible in our respective areas. So that's why this Eye Bank GMCH 32, we try to organize these programs, and every year your college gets involved very seriously. We are seeing that for I think maybe more than 8 to 10 years, we are seeing the regular program is being held in your college. So that's a great thing because you take keen interest in all these social activities. So I'm really thankful to all your management. So now coming to the topic itself. So I think everyone can unmute themselves whenever they want to ask any question. Otherwise, you can keep your this mic muted. Otherwise, there will be a disturbance. So whenever you want any question, any doubt, you can ask. So normally in your good auditorium, I take the class. So there it is an interactive session. So we can interact. Here I can't see any face. So it is just I'm seeing the screen, laptop screen. So very difficult to interact. But still, I will like that students, if they can unmute, not unmute. They can keep the video on so that we can interact. That is much better. Otherwise,
some of you can bring your video on, बच्चों. अभी रोल नंबर और अटेंडेंस मत डालिए, प्लीज सर डिस्टर्ब होंगे स्क्रीन पे, बाद में करेंगे. अभी आप अपने कैमरास पे आ सकते हैं, तो प्लीज आइए.
नेटवर्क अलाउ करता है तो that will be much better so that I can interact, I can ask. Otherwise, I will ask my names also. So regarding eye donation, I pledge very simple thing. Before I share my PPT, I will first like to Just simply ask, let's see how the student, they are aware about this thing. Very simple question usually asked from many students. I donation, I pledge, what is the difference between the two? So that once this clarity is there, then further things, they can be very easily understood. So who can tell or who can share difference between I donation and I pledging? So anyone? So we have
I pledging is done while you are alive and you pledge your eyes.
Yeah, very good. And donation?
Donation can be done either by the person, I mean, when he has pledged after his death, or donation can be done by the family of the person who has died. This is what I
Yeah.
mean.
So you are absolutely right. Basically, the difference is pledging is for motivation only. So pledging means we want to pledge that I will donate my eyes after my death. And donation will actually happen after death only. So during living, other organs like kidney and liver, there are so many other things, they can be donated and they can be used also. But eye donation, as per Human Organ Transplant Act, there is a HOTA Act 1994. So according to that act, only person who has died, he can donate eyes. So basically, because he has died, his family members, they will come forward, they will contact the nearest eye bank, and then their family members, once they call the eye bank team, so then they will get consent from the family members. Only then eye donation can happen. So in this regard, even if somebody has pledged his corneas, like somebody pledges today that I will donate my eyes after my death. So once he dies, eye bank team goes to his house. So then his family member, if they say, no, we don't want to donate his eyes, so then also we cannot get the eyes. So that's why this pledging part is basically for motivation of the person and his family also. So if the family member, they are not motivated, then this pledging is not going to be converted into eye donation. So that's why whatever you hear, whatever you listen, important thing is these things must be discussed with the family members, and then all of them, they should be you can say voluntarily ready and motivated for doing eye donation. Otherwise, simply by pledging, you cannot get the eyes. Only after consent from the family members, one can donate his eyes after he dies. So that is the difference between the pledging and the donation. Then coming to, let's share this PPT. So can you see my slide? My slides are visible. Can somebody say?
Yes, sir.
Okay. So you can see basically this is the diagram of the eye where you can see the anterior part of the eye. Like this is our normal eye. So this transparent part is cornea, and behind that this brownish what we see, that is called as iris. So that you must have heard in 10th or 11th, 12th class. So that is this part which is transparent in front of the iris, that is cornea. So that is the tissue which is donated and that is used after donation. Otherwise, rest of the part of the eye, that is not used after donation. Nowadays, in fact, we do not even take. So whenever we go for eye donation, we just remove this part only. This rest of the part, iris. Then behind that there is a lens. Then there is all retina and there is a vitreous. So rest of the part we do not touch when we take the donation. So only front part, that is cornea, only that part we remove from the dead body. So this part is called as cornea. So this will be useful when the recipient who is blind, is the rest of the part, that is retina, his optic nerve, and everything, that is normal. If everything is normal, only the cornea is opaque, because of that he is blind. So if we change the cornea, then he will become normal. But suppose his retina is also diseased, then even if you change the cornea, he will not be able to see. So that's why it is important that whenever we are operating, we first check whether his retina is normal or not. If retina is normal, only then we transplant the cornea, otherwise we don't transplant. So it is a cornea transplant basically in eye donation. So just coming to very important few causes in our country, the most common cause for corneal blindness. So you can see a patient comes with this type of picture, the person who is blind because of corneal. So this is one of the reason like corneal infection. So in our country, the most common reason for corneal blindness is corneal infection. Why corneal infection happen? This is because of our own problems most of the time. Because people do self-medication. So whenever they have something in their eyes, like some dust particle, foreign thing, so rather than washing their eyes, they try to put many things like honey, gulab gel, or they can go to chemist and they can get some like some steroid eye drop, then they put in their eyes. So actually, if you do not put a steroid eye drop, his cornea after infection may become normal. But once you put steroid, then this type of picture becomes that he becomes almost blind. So the message from this slide is that whenever anything happens to our eyes, whether it is red eye or something goes into the eyes, we must just thoroughly wash with normal clean water. That is the only thing required. After that, we can go to eye surgeon, eye specialist, who will examine the eyes. And if there is some problem, he will prescribe usually antibiotics only. No steroid should be given. So then his eye will become normal. If you do self-medication, contaminated gulab gel, contaminated honey, or anything else, or steroid, if you put these things, then your cornea will become like this. Then person will require cornea transplant. So this we can prevent. Sometimes we see patient, they are coming at very late stage, so late that even the cornea is getting perforated. So this brown tissue you can see, that is iris. So from the cornea, this iris tissue is trying to come out. So that is a perforation. At this stage, you need one cornea in your eye bank immediately. If you have cornea, then you can replace it immediately. If you don't have, then person will further have increased perforation of the cornea, and ultimately his iris tissue, his lens, his retina, optic nerve, everything will come out, and then he will become blind forever. So that's why we need eye bank, where we should have some corneas available all the time if patient comes with this type of picture. So another important reason in our country is vitamin A deficiency. In our country, although there is a vitamin A deficiency, vitamin A prophylaxis program, Government of India distributes free vitamin A to all the female during pregnancy and all children below 1 year of age. So all these children and the pregnant female, they must take vitamin A dose. If they do not take and they are having less diet or improper diet, then vitamin A deficiency can happen usually during the first year of child. So during that time, if there is vitamin A deficiency, then child may develop, infant may develop this type of white spot that is called as Bitot spot. Then if this deficiency continues, then what will happen is cornea will get involved. During that condition, his cornea, if it is deficient very seriously because of vitamin A, his cornea even may melt, just like ice melts in summer. Similarly, his cornea will melt and it will perforate. Then that child will become blind forever. So these children, again, they require cornea transplant immediately. So it is a preventable problem. So one must take vitamin A during birth, after birth. So after birth, all the children, they should be given vitamin A dose. That is usually 3 doses are given at birth, then after 6 months, then after another 6 months. So then this problem will not happen. Then injuries, trauma, they are again very important causes of corneal blindness. So we see so many children, so many young adults coming to us with corneal injury because of not wearing helmets. That is one very common reason. Other reason can be so many other accidental injury in the factories or workers. So one can have injury to the cornea because of so many things. Whenever there is a trauma to the cornea, cornea will become white even if you suture the cornea. So that's why all these patients, although we will try to save the cornea at that time, so eyeball will be saved, but his vision will come once his cornea is transplanted later on. So that's why all these patients with corneal trauma ultimately will require cornea transplant also. So there are many few children who are born with corneal blindness due to some chromosomal anomaly or some other problem. So by birth, there is a opacity of the cornea. So like you can see, so these children, they will definitely require cornea transplant. We can see almost 20% of the blind population of the world lives in India. So we have almost 68 lakhs corneal blind, and 10 lakhs people have blindness in both the eyes. So that's a very great magnitude of problem. So that's why we need so many corneas. If we see demand and supply, we need at least 1 lakh cornea every year to clear the backlog. But we are getting maximum 35 to 40,000 corneas every year, and to which 15 to 20,000 new corneal blind are added every year. So you can see backlog keeps on increasing because we are not getting so much corneas. So that's why there is need for all these eye donation programs so that people get motivated and ultimately they will help in cause of donation. And if we see the number of deaths, almost 8 to 9 million deaths occur every year in India. So in spite of so many deaths, still we are lacking cornea because people do not want to donate. So if we see the people, one eye donation means giving eyesight to minimum 2 blind people. But nowadays, in fact, by technology, we are doing surgery in a way that even one blind person, he can give 2 corneas, and these 2 corneas will be used for maybe 5 to 6 patients as well, because cornea has got 6 layers. So all the blind patient, they may not have problem to all the layers of the cornea. Some patient may have just problem to 2 or 3 corneas. Some may have just 3 layers. Some may have just 1 layer. So then we do not change all the layers. We just remove those layers which are opaque. The rest of the layers we do not touch. So thereby we can give 1 cornea to maybe 3-4 blind people. So one person who has donated his 2 corneas, he can give eyesight to maybe 4, maybe 6 also. So that is a great achievement by this eye donation. So normally after death, what we are going to do is we are going to burn the body or bury the body. So we can do both the things, but after removing the corneas. If you remove the cornea, then you bury the body or burn the body, then there will be no problem. But just burying the corneas also or burning the cornea with the body, I think that should not be done. So there are few doubts in the mind of the people, like people think that I'm having diabetes or hypertension, whether I can donate or not. It's a very simple thing to remember for all of you, that any person having any disease, except those diseases which can be transmitted through the blood, those diseases can be excluded. For example, HIV, AIDS, or hepatitis. And nowadays, even this, you can say virus, which is highly transmissible, that is COVID. So any person dying because of hepatitis or COVID or because of HIV. So these corneas we cannot use. So that's why we will not take donation from them. Otherwise, take name of any disease, be it hypertension, diabetes, thyroid, or any other disease. In all these diseases, the cornea is not affected. Cornea remains absolutely normal. So that's why all of them, they can donate the corneas. Even some people think that I'm wearing glasses, so whether I can donate or not. So whether wearing glasses or using contact lenses, or whether undergone any eye surgery like cataract surgery, glaucoma surgery, retina surgery. So in all these conditions, your cornea remains absolutely normal. So once the cornea remains normal, then that cornea can be donated. Even patients who are undergoing nowadays LASIK surgery, like surgery for removal of spectacle, so their cornea also remains normal. So any patient undergoing corneal surgery for removal of glasses like SMILE, LASIK, PRK, even their corneas also can be donated. Not only that, like some person who was blind and he got new corneas, cornea transplant done for him. So once that person dies, so his transplanted corneas also can be donated, and those corneas can be retransplanted. I'm sorry. So we can see there is endless advantage of eye donation. One donor gives to other person So that person can give cornea to another person also. So that can be reused because cornea is not affected by any of the disease. In that way, one person can give eyesight to so many unlimited number of people. So basically, other reason is like all these causes I told you, they can all donate the corneas. Sorry. Some people think that removal of eyes may take so much time, because of that funeral may be delayed. So I can tell you very clearly that just a removal of the both eyes, it does not take more than 10 to 15 minutes only. And because of that, there will be no funeral delay, because whenever we receive any eye donation call in our eye bank, so our eye bank telephone number works for 24 hours. So whenever we receive any call, so immediately we rush and then get the corneas. So there will be no funeral delay because of donation of the corneas. Then another question is very important. After death, how much time should be there for donation? So practically, it is seen that if donation happens within 6 to 8 hours, then the quality of the cornea remains best. If we delay the donation, then although donation can be taken, it can be used also, but the quality of the vision to the recipient, to the blind, will not be as good as it could be. So that's why it is suggested, recommended that cornea should be donated within 6 to 8 hours. Then a few other things which are not important for you student, but the older generation, they have so many myths in their mind. So many people, because of useless reasons, they do not donate the corneas. Like I written a religion. In our country, like many people who are too religious, I will say not religious, pseudo-religious, because the true religion doesn't say that cornea should not be donated. But the pseudo-religious people say that if somebody donates cornea, he will be born blind in his subsequent birth. So that's a great myth. So first of all, we don't know whether second birth will happen or not. If it happens, then why he should be born blind once he's doing such a noble cause? Other thing, people think that if somebody donates his corneas, so then when the rituals are done during cremation, then rituals are not proper because of organ donation. So then he will not go to heaven. So again, it is a very great foolish thought that somebody who is donating the corneas, he will not go to heaven. Other people, those who are not donating, they will go to heaven. I think it should be reverse. If somebody is doing some great job, he is the only person who should go to heaven, I will say. And this our scripture also says, like if we do good, then definitely we will get the good results. Whatever karma we do, same benefit we will get, same result we will get for karma. So these are just myths because of that, because we go to emergency areas where some death happens. So there our social workers ask for donation to the family member. So they usually refuse because of these reasons, that this will happen. He will be born blind, or he will not go to heaven. So that's why I'm telling these things. But in your generation, I think these thoughts may not be there. And then definitely the teachers, students who will be taught by you, they will also not have these thoughts. Then maybe after a few years, this problem will not be there in our country. In fact, religion should help in eye donation. Like we have seen Buddhists in Sri Lanka, almost everyone is Buddhist. In Buddhist philosophy is that they must donate their corneas, so they want to do good for others. So Sri Lanka is a very small country, but they are exporting cornea to other countries because everyone donates there. Even our country also gets few corneas from Sri Lanka. So that is the difference. So religion should help in eye donation rather than hindering the cause of eye donation. And of course, there is a lack of awareness for eye donation. Like many people, they want to donate, they don't know what to do. So that's why this awareness is very important. So for donation, it's very simple way to donate. The only thing is one has to just give a call to the any eye bank. Like in Chandigarh, we have got eye bank in PGI, and we have got eye bank in our Government Medical College, Sector 32, Medical College Hospital. So you can have all these telephone numbers, they are given in the newspapers also. You can Google iBank telephone number. So you can contact to any iBank. So immediately iBank team comes, and then rest of the things they are done by them. So it is not very difficult or complicated thing how to donate. So very simple, just call iBank, that's all. Then after that, within half an hour to 1 hour, things are done automatically. Team comes, they bring the form, that is consent form. So that form is filled by the parents. So there they give the consent that yes, we want to donate. So when the consent is given, then the team does his job, and within 15 minutes, both the eyes are done and things are finished. So that's a so easy procedure. Then there is no disfigurement because of eye donation. Some people think that face will look disfigured. So as I said, we get only cornea, we do not get whole of the eyeball. So once that cornea is removed, I will show you this surgical procedure also just now. So once this cornea is taken, that is replaced by some artificial cornea, plastic cornea. So other person who is seeing the face of the dead body, he even cannot know whether some donation has happened. So it's such a simple procedure, and face is not at all disfigured. So then forgetfulness is there, like there are many of us, we will pledge also, we will remember also, but at the time of death, because of emotions, because of so many other, you can say mental trauma, we forget everything. Then the actual donation should happen. This does not happen at all. So that's why we have to be motivated all the time. Then only during death, this thing can be done. Legislation means, like in some countries, there is a presumed consent of eye donation, like somebody dies in the hospital. So automatically this organ donation, eye donation will happen without consent. Only consent will be required if they do not want to donate. But in our country, we have to get consent even in the hospital for organ donation, eye donation. If they do not give consent, we cannot get the corneas. But in other countries, it's a presumed consent that everyone dying in the hospital, he will have to donate the corneas or the organ. So like you can see this very small video. So this is just a removal of the cornea tissue, you can see. So very simple procedure, just we take the scissor and cut this. This is a cornea, this is sclera. To support this cornea, some amount of sclera is taken. Now this tissue is being removed. So now you can see procedure done, just 2-3 minutes. Then it is no blood, nothing. And this is then being covered by this plastic shell. So it is an artificial plastic shell. So eyeball, face, everything looks just like normal. So very simple procedure. So once this is done, then this cornea is brought to the hospital. So where this tissue is assessed in detail. So we want to see what is the quality of the cornea. So we grade the tissue and then we keep in this called as solution or the MK media. So it is a preservative solution, in that we keep the cornea. So why want to keep in that? Because we want to operate the patient, and that patient may be coming from far off place. So like in our iBank, so we register all the patients who are cornea blind. All the patients, they are registered and they are called as per their turn. It is not that we can call any person. As per the register which is maintained for all these blind patients. So that person may be from Punjab, maybe Haryana, maybe J&K, maybe Himachal, anywhere. So one can be getting registered in our iBank from anywhere. So when that is registered, then when we receive the cornea, so that person may take maybe 12 hours, 4 hours to come to our hospital. So during that time, this cornea will be kept in this solution, so that corneal condition remains normal. So when that patient comes, then we operate, and then corneal transplant is done. That's why this medium is required. So you can see, like this patient having this corneal cornea will become like this. Another patient like this, it becomes like this. So that is how the corneal transplant works. The central part of the cornea becomes normal, and then person can see just like normal person. So as already discussed, so pledging, basically all of you can pledge. So there is a pledge form which can be sent to your college. So there you can fill the form, basically telling your family members as well that you want to donate. So then that pledge form we get, and we give one donor card to you. That donor card basically has the telephone number. So like the donor card, on donor card, telephone number of the iBank is written, so that this telephone can be contacted after. So this is the telephone number of our iBank GMCH. That is 9814821212. So you can note down this telephone number. So whenever you have any query, you want to know anything about eye donation, eye pledging, or you want to organize even this program anywhere, You can give a call at this number, and then definitely we will come and help you in this cause of eye donation. So that is very simple procedure. So that was all about this procedure of eye donation. I hope everyone must have understood. There may be few queries you can ask. Most welcome. Any doubt about eye donation procedure or any other technical things? Other thing is, in our hospital, in our eye bank, 32 Medical College, all these surgery they are done free of cost related to cornea transplant. The patient who is registered with us for cornea transplant, we do not charge anything from him. And the person who donates corneas, he is also not given any money for that. It is a total free procedure from the donor as well as to the recipient. So no money is exchanged in this procedure, and everything is as per Human Organ Transplant Act. And anyone you know who is cornea blind, there's some problem, you can send to our eye bank, our hospitals. Then his name will be registered, and then he will be operated free of cost. So you can help in your neighbors, anyone you know that who is having some blindness, so you can send that person to our hospital. We'll be happy to help that family. Thank you very much. Any query, any question? Most welcome.
Thank you, sir, for very systematically informing about the whole procedure and also removing the hunches about it, maybe the undue apprehensions that one may have. Now the house is open, so first any student, if he has questions, if you have any small or innocent questions or doubts, are most welcome. Dr. Sir will answer. बच्चों किसी ने कुछ पूछना? सर मेरे मन में दो बातें आती हैं. एक तो not directly related, but I wanted to have a guidance on the usual screen time that we students and the people who like teachers also screen time बढ़ता जा रहा है. तो हमें अपनी healthy आंखों के लिए एक तो major blunders जो हम करते होंगे. एक मैं देखती हूँ अपने बच्चों को भी, घर में भी हम देखते हैं, अक्सर हम लाइट बंद करके सेल फोन यूज कर रहे होते हैं. So if there are any very day-to-day things that to keep eyes healthy, and the other question related is that what is the number that is what is the incidence or the statistics of the cornea replacements which have been done say in Chandigarh or your institute? कितने patients sir वीकली बेसिस या मंथली बेसिस, मतलब जो भी रेलेवेंट पैरामीटर है हमें समझाने के लिए कि व्हाट इज गोइंग ऑन. यूनिसेफ वाली एड्स तो हम देखते हैं टीवी पे जो डेली बेसिस पे आती है. सो जस्ट वांटिंग टू अंडरस्टैंड व्हाट इज द एक्चुअल रिप्लेसमेंट गोइंग ऑन in terms of the beneficiaries of from the donor.
First, coming to the second question, like in our eye bank, the person, now just if you forget these 2 years of COVID, during that time everything stopped because the donation was not possible because of the disease was such. So there was no donation, no surgery during these 2 years from 20th and 21. So now we have restarted the things, but before that the data was like every year we are getting around 300 to 400 cornea in our eye bank. So, but actually we need at least 500 to 600 corneas. That is about our eye bank, I'm saying. So like in our eye bank, the people who are registered, so they have to wait for minimum 1 year for their turn to come. So 1 year was the waiting period. That was before COVID. So now this waiting period will increase further because now for the last 2 years no donation has happened. So now it will increase further, maybe 1.5 years or 2 years. And because now it is again picking up, so it will take some time to again have same number of donations, because in the periphery also people who are donating for that also has also stopped. So that's why now it is very, very important that we have to increase the number very fast. Otherwise, so many blind people they will have to wait for maybe 2 years or 3 years. Initially, when we started eye bank in 2001, the waiting like we used to collect maybe 30-40 corneas in a year. That was 20 years back. Gradually it picked up. Now it was almost 350 and 400 for last few years. So that was waiting period was in fact coming back to almost 3 to 6 months also. Just before COVID, it was almost 3 to 6 months, and before that was 1 year. But now again, it will jump to, I think, more than 1 year. So that's why it's very, very important. Then coming to first question, like how to maintain health. So all of us, we are using this mobile, TV and laptop so much. So because of that, the one very important condition which developed, that is called as dry eye syndrome. That is also called as computer vision syndrome. So because when we use this computer, laptop, mobile, so our blink rate that decreases. So normally with blinking, what happens? Our tear they do not evaporate. Other thing is tear, they get uniformly distributed over the cornea. So when this blinking is not normal due to staring over the mobile or the laptop or whatever we are using. So because of less blinking, what happens? Our cornea tear gets dried up. So because of that, we develop a sort of symptom like foreign body sensation, gritty sensation, itching, mild redness, fatigue, teary eyes. So all these symptoms we develop. So once these symptoms are there, that means we are having dry eye. So for that, our blinking habit should be okay. So one thing is like our eye and the level of the laptop, especially if we're working on the computer, that should be at the same level. Then other thing is we should never ever use this see TV and all this in mobile when the lights is off. So that will cause more light entry into them. When there is a darkness, our pupil size increases. So then more bad light enters into our eyes. So more UV light. So that damages our retina also. So that causes pressure on the eyes also. So the symptoms which patient will have usually, one is this dry eye symptom, other thing is fatigue. Fatigue leads to headache. So many children, the student, they develop a lot of headache. So that is because of frequent and too much use of mobile. That is another reason. So what should we do is if we are supposed to use mobile for many hours, maybe your laptop to do some study, then ideally after half an hour, we must close our eyes or we should look at a distance. So once we do that, then our ciliary muscle that get relaxed. So then there will be no strain over the eyes. So many children, they develop strain. So strain means we are constantly watching at the near things. So then our muscle, they won't go into spasm, that leads to headache. So to prevent that, what is very simple treatment? We should just close our eyes after half an hour for maybe 10-15 seconds only. Or we can look at distance. And those who are working for maybe 4 to 5 hours daily on computer, they should put artificial tears. Like one common drop is comfort eye drop or refresh your eye drop. So if you put these drops just twice or thrice a day, one drop, then we'll feel very comfortable. So dry eye will be taken care. So these are the two things. Less, we should use less as possible, this mobile and laptop. And if you are forced to use it, there is no option, then we must use some artificial tear drops. And then we should try to blink more. These are the precautions. Otherwise, if we do not blink, then tears will get evaporated. Then we will have dryness. Then our eyes will become red, fatigued, tired. Then gritty sensation, foreign body sensation. These things will be, these symptoms will be there. Okay, so very simple treatment. Just do less, do more this closure of the eyes. Then see at a distance, and then put artificial tear drop if you have already developed these symptoms. No need to come to hospital also. Other thing is we must have our vision normal. So like too much use of these things, that leads to a strain on the eye. So that leads to, you can say, spectacle also. So if you have some spectacle number which we are not using, that itself leads to headache. So that's why everyone, we must get our eyes checked up whether we have got 6/6 vision or not. If it is not, then we should not use laptop mobile before getting this number. If you have proper number, then if you do the work, then there will be no problem. But if uncorrected, any refractive error, that definitely leads to not only headache, but even many children, they will develop squint also. So there should not be any refractive error, means myopia, hypermetropia, which remains uncorrected. If you do not want to use glasses, come for contact lens, or even we are doing LASIK, come for LASIK, but never keep it uncorrected. So whether you want to use glasses, okay. If glasses not okay, go for contact lens. Contact lens you don't want, then go for LASIK or other surgery. Now these are quite safe surgeries. But we must get our vision corrected by any means. So then you will not develop any headache. Okay.
Thank you very much, sir. Any more questions, please? Any question, any doubt? Otherwise, I invite my colleague Ravinder ji to propose a vote of thanks. So please come in if anyone has a question.
Yes, Ravinder, I think he wants to ask something, or his teacher.
So, our colleague ji, Mr. Ravinder Kumar, my teammate as a NSS program officer. So,
किसी बच्चे का
any
कोई
questions,
प्रश्न नहीं है,
बच्चों?
तो सब बच्चों को समझ आ गया इसका मतलब, या कुछ समझ नहीं आया? अच्छा,
सर ये एक्चुअली दे गेटिंग वार्म्ड अप, अभी इनको 3-4 दिन हुए हैं फील्ड में गए हुए इंटर्नशिप के, तो ये अभी वो 8 से 2 वाला सिस्टम एब्जॉर्ब कर रहे हैं कि करियर क्या होता है. सो आफ्टर 2 o'clock rush stop, maybe somewhere some of them are on the way back or something. So I think they are learning life, and of course आपका जो कंटेंट था वो सेल्फ एक्सप्लेनेटरी था, और हम कोशिश करेंगे कि इसको एक मूवमेंट की तरह लेके आए. Once we have a next event, आमने सामने, I think एक बार जब एक बात चलती है तो वो कनेक्ट होती है as to where can we be beneficial to the community when we actually physically do not exist anymore.
I think
Ravinder ji,
फोर्टनाइट के बाद भी जैसे मतलब इट इज नॉट टिल 8 सितंबर के बाद भी जब आपको कॉलेज फिजिकली स्टार्ट हो जाए, आप फ्री हो, तो कभी कभी भी कर सकते, थ्रू आउट ईयर वी कैन डू एनी टाइम.
हाँ जी सर, हमारा एनएसएस कैंप as proposed, if everything goes on in the same rhythm, then we are having the NSS camp during at the tail of October. Proposed is 28th October onwards for 7 days. So we will have a session one more time when we have new batch in. Yes.
Yeah, definitely.
The fresh batch or the first. Ravinder ji.
जी जी, thank you ma'am, thank you. Respected principal sir, respected NSS Incharge Dr. Ravneet Chawla ma'am, and speaker of the day Dr. S.K. Arya ji, and my dear students, बहुत ही खुशी हो रही है मुझे कि मैं डॉक्टर साहब का धन्यवाद करूं कि आज डॉक्टर साहब ने हमारे लिए समय निकाला और आप सबको और हमें आज बहुत ही महत्वपूर्ण जानकारियां उन्होंने दी. देखिए, नेत्रदान जो है वो हम सब जानते हैं, इस बात से हम सब लोग वाकिफ हैं कि हमारे लिए जो दुनिया है उसकी सुंदरता और ये जो हमारी सृष्टि है उसको निहारना, उसको अप्रिशिएट करना, ये सब कुछ जो है हमारी आंखें उसके लिए बहुत जरूरी हैं. और बहुत ही अच्छी बात सर ने कही है कि नेत्रदान जो है वो हमें जरूर करना चाहिए, और सर ने बहुत ही मेडिकली सर ने जो जानकारी आप सबके सामने रखी है कि हम किस तरीके से उन भ्रांतियों से निकले हैं जो भ्रांतियां हमारे समाज में फैली हुई हैं आई डोनेशन को लेकर के, तो वो बहुत जरूरी है. और सर मैं आपसे एक बात शेयर करना चाहूंगा कि इसी साल मैंने एनएसएस की ट्रेनिंग जो है, प्रोग्राम ऑफिसर ट्रेनिंग हमारी होती है, तो वो मैंने अटेंड की थी. और उस ट्रेनिंग में सर एक बात बताई गई कि एक छोटा सा कंट्री है श्रीलंका, और कहते हैं कि उस कंट्री में आई डोनेशन को लेकर के इतनी जबरदस्त अवेयरनेस है कि वहां पर कोई भी जो इंसान है वो ब्लाइंड नहीं है, और कोई भी ऐसा इंसान नहीं है जिसको अगर आंखों में कोई प्रॉब्लम है या उसकी आंखें जो हैं वो किसी एक्सीडेंट की वजह से या बीमारी की वजह से चली गई है तो उसको आईज जो है वो नहीं मिलती. और दूसरी बात कि वो बाहर के देशों को भी ये जो आंखें हैं वो जो है एक्सपोर्ट करते हैं. तो ये जानकारी मुझे सर वहां पे मुझे प्राप्त हुई और मैं बड़ा हैरान हुआ सर ये सुन के कि एक छोटा सा कंट्री जो हमारे देश के, अगर हम देखें तो हमारा इतना बड़ा देश और वो तो एक छोटा सा कंट्री है. मुझे नहीं पता सर इस बात में कितनी सच्चाई है, ये तो सर आप मुझे बेहतर बता सकते हैं. लेकिन सर जब ये बात
ने मेंशन किया था, आई थिंक मे बी यू आर इन द रास्ता, सर ने ये बताया श्रीलंका का एग्जांपल खुद से.
ये फैक्ट है, इट इज अ फैक्ट. इवन हमारा कंट्री, हमारा देश भी उनसे कॉर्निया लेता है.
जी सर. तो सर आपने भी जैसे बताया, तो सर मुझे लगता है कहीं ना कहीं सर अगर चेतना की जब हम बात करते हैं सर, अवेयरनेस की, तो चेतना जागृत करना जो सबसे ज्यादा इम्पोर्टेंट है, और उसी के बारे में सर आज आपने बात की। तो सर मैं बहुत बहुत आपका धन्यवाद करता हूँ सर, हमारे बच्चों को आपने इतनी महत्वपूर्ण जानकारी दी। और मुझे लगता है सर कि आज आपने जो उनको एक टेक्निकल और लॉजिकल जो चीजें आपने बताई हैं, तो वो उनको जानने के बाद मुझे लगता है कि इन बच्चों के अंदर जरूर ये बात आएगी कि हमें खुद भी इस बारे में सचेत होना है और लोगों को भी सचेत करना है। सो थैंक यू सो मच सर, आपका बहुत बहुत धन्यवाद सर, आपने बहुत महत्वपूर्ण जानकारी आज हमें दी है सर। मैं आपका अपने कॉलेज की तरफ से, अपने बच्चों की तरफ से और पूरी एनएसएस यूनिट की तरफ से मैं आपका बहुत बहुत धन्यवाद करता हूँ सर। थैंक यू सो मच सर, थैंक यू।
Okay, thank you all. Thank you very
Thank
much.
you, sir. One more time.
And thanks a lot. Thank you, everyone.
Thank you, sir. Thank you, sir.